Posterior cranial fossa. The posterior cranial fossa contains the cerebellum and brainstem, parts of the brain. And in the middle, you can see this large foramina, which is known as the foramen magnum. Anteriorly, in the midline, it is bounded by the diaphragma celli. Remember from the previous lecture that diaphragma celli or diaphragm celli, dorsum celli actually, not diaphragma, dorsum celli, actually is the upward or superior projection from the body of the sphenoid, ending laterally into two tubercles, very small rounded elevations known as posterior clinoid processes. These are the anterior clinoid processes, lesser wing of sphenoid, and body of sphenoid say posterior clinoid processes. Anterolaterally, the posterior cranial fossa is bounded by the apex or the upper border, superior border of the petrous part of temporal bone. And posteriorly, it is bounded by the internal surface of the squamous part of the occipital bone. This whole of the bone is known as occipital bone, particularly its squamous part. Floor of the posterior cranial fossa is formed by the mastoid part of the temporal bone, squamous part of the temporal bone, and basilar part of the occipital bone. So in the middle down here, you can see the basilar parts of the occipital bone. Further down laterally, this is the mastoid process, right? So turning it inward, there we have the mastoid part of the temporal bone. Rest of it is formed by the squamous part of the occipital bone and basilar part of the occipital bone. So the squamous part of the temporal bone, mastoid part, and occipital parts, they form the floor of the posterior cranial fossa. In the middle, a very large foramen is present, which is known as the foramen magnum. Anterior to the foramen magnum, if you look closely, you see a sloping part of the bone. Again, this is occipital bone, but this particularly sloping part of the occipital bone that is extending from the from the diaphragm, from the dorsum celli downwards till the anterior-most boundary of the foramen magnum. So this basilar part of the occipital bone is known as, this sloping part of the occipital bone is known as clivus, C-L-I-V-U-S, clivus, right? Extending above anteriorly from the dorsum celli down till the anterior-most extent of the foramen magnum. If you look at the petrous part of the temporal bone, the anterior sloping surface of the petrous part forms the posterior boundary for the middle cranial fossa, and its posterior sloping part forms the anterior boundary, anterolateral boundary for the posterior cranial fossa. So over the posterior sloping surface of the petrous part of the temporal bone, you can see a foramen which is known as internal acoustic meatus. So here is the internal acoustic meatus, and just below immediately below the internal acoustic meatus, another foramen is visible on either side, right and left. This foramen is known as jugular foramen. Further going down but remaining superolaterally to the foramen magnum, you can see another small foramen on either side of the foramen magnum. This one, this. It is known as hypoglossal canal. The other features that are visible in the posterior cranial fossa going posterior to the foramen magnum. You can see the two fossae, hollow, slightly hollow fossae in the squamous part of the occipital bone. These fossae are known as cerebellar fossae because they lodge the cerebellar hemispheres. And these two fossae are separated in the midline by a sharp raised ridge of bone known as internal occipital crest. Right? Internal occipital crest. This one. Further posteriorly, just above and laterally to the internal occipital crest, you can see grooves on either side of the midline. These grooves, the two that are visible over the posterior most aspect of the posterior cranial fossa, they are known as the grooves for the transverse cerebral sinuses. So what is a transverse sinus? It is a separate topic. It is one of the dural venous sinuses. Each of the transverse sinus leads into an S-shaped groove, right? This S-shaped groove is for the sigmoid sinus, again one of the dural venous sinuses. It is basically this sigmoid sinus, you can see this groove for the sigmoid sinus is leading into the jugular foramen, right? So you will remember from here that since groove for the sigmoid sinus lodges sigmoid sinus, and sigmoid sinus continues through the jugular foramen as internal jugular vein. Similarly, on the other side, you can see. So this was all about the posterior cranial fossa and its foramina and different bony landmarks present in it.